Good morning. My name is Samir. I'm associated with Moffitt Cancer Center in Tampa, Florida. Thank you to Saeed for the opportunity to present. We're comparing Botox injection versus pyloric surgery for the prevention of delayed gastric emptying after esophagectomy. I have no commercial relationships to disclose. Esophagectomy after multimodal neoadjuvant therapy is the current mainstay treatment for esophageal and some GE junction cancers. Delayed gastric emptying is a common postoperative complication affecting up to 39% of patients post-esophagectomy. It is believed that resection increases the likelihood of DGE because the procedure involves severing the vagus nerve, which innervates the pyloric sphincter. Historically, pyloric drainage procedures were performed were thought to be performed in order to prevent delayed gastric emptying. DGE also places more pressure on the anastomosis, which leads to an increased risk of anastomotic leak and aspiration pneumonia. The risk factors for DGE are still not clear. Some have found that COPD could predispose patients to the condition, while others have found that it could be caused by nerve damage due to poorly controlled diabetes. Many approaches have been proposed to prevent DGE, but controversy still surrounds which one is the most effective and the safest. Surgical operations such as pyloroplasty and pyloromyotomy involve making an incision into the pylorus to relieve pressure, or alternatively, intrapyloric Botox injections are less invasive and easier to administer. Previous studies have compared a variety of approaches and in general have concluded that while pyloric intervention is better than no intervention, there's little difference between drainage procedures in preventing DGE. However, few studies have solely compared pyloric surgery to Botox. Our study's objective was to evaluate the effects of intraoperative pyloric Botox injection versus pyloric surgery for preventing DGE after esophagectomy. This is a retrospective review of Moffitt's IRB-approved database of 1,364 esophagectomies performed between 1994 and 2023. We found 475 patients that either received a Botox injection or pyloric surgery during esophageal resection. 238 of these patients received Botox injection, while 237 underwent pyloric surgery. We used chi-squared and ANOVA analyses to compare demographics, clinical characteristics, and outcomes between Botox and pyloric surgery patients. And we also performed a propensity scored sub-analysis which matched for age, gender, race, receipt of neoadjuvant therapy, histology, and diabetes status. The two cohorts were similar in terms of age and had similar proportions of COPD and diabetes, but a greater proportion of Botox patients were male, non-Caucasian, and had neoadjuvant therapy. There was a significant difference in operative approach, with Botox patients more likely to undergo a fully minimally invasive robotic Ivor-Lewis esophagectomy, while more pyloric surgery patients had a hybrid open robotic Ivor-Lewis approach. And this is because drainage procedures were performed based on surgeon preference. For our primary outcomes, rates of DGE, anastomotic leak, and pneumonia were all similar between the two groups, but there was a significant difference in length of stay, with Botox averaging 9.8, while pyloric surgery patients averaged 12.1. Based on our matching variables, 178 patients in each cohort were compared, and the outcomes of this sub-analysis were similar to our previous results, with rates of DGE, anastomotic leak, and pneumonia remaining similar between the two cohorts. And Botox injection was still associated with a shorter length of stay. In summary, rates of DGE were similar between the Botox and pyloric surgery cohorts. There was no difference between cohorts in anastomotic leak and aspiration pneumonia, and Botox injection was associated with a shorter length of stay. Similar to current literature, our data suggests that both Botox injection as well as pyloric surgeries, in this case pyloroplasty and pyloromyotomy, are equally effective in treating or in preventing DGE after esophagectomy for esophageal cancers. The difference in length of stay between the two cohorts is most likely due to operative approach, but this makes sense considering Botox patients underwent a fully minimally invasive procedure compared to the hybrid open procedure for pyloric surgery patients. This difference in operative approach, because of this, further investigation is required to investigate whether there truly is a difference between these cohorts in postoperative outcomes, and it also drives the need for further investigation into the exact pathophysiology and risk factors for DGE. Thank you.